2, 3, 4, 5. Hi, welcome to our called City Council meeting this Friday, April 24th. We welcome everybody who is joining us. I will call to order this meeting, and we will start with Tara Music giving a roll call. Tara?
Fire Robin.
Here.
King.
Here.
Powers.
Here.
Luttrell.
Here.
Turner.
Here.
Thank you. City Manager Bill Sora, can you introduce the folks who are joining us today from staff and from our...
Yes, Mayor, I'd be glad to. On the staff side, we have Daniel Smith, City Attorney, Tara Music, our City Recorder and Finance Director, Terry Napier, our Director of Parks and Recreation, and Annette Tudor is joining us as Director of Bristol, Tennessee City Schools. Other guests on the meeting today, we have Gary May,
Hey.
Director of Sullivan County Regional Health Department, Dr. Stephen May, Chief Medical Officer from our health department. We also have Greg Neal, CEO from Bristol Regional Medical Center, and I think Dr. Chad Couch will be joining us later today also from, or later this morning also from Bristol Regional Medical Center.
Thank you very much. And I'll just say that we've had a few technical difficulties opening up. And also I'm showing that occasionally my internet is unstable. So I've talked previously to Vice Mayor Madeline Luttrell. So if I go silent or freeze up or whatever will depend on you to continue the meeting while our technology falls into place. Next, we need to, every time we have one of these electronic meetings, we have to have discussion of necessity to affirm that. Attorney Danielle Smith, can you just review that with us briefly?
Certainly, Mayor. In compliance with Governor Lee's executive order number 16, which suspended the requirements of the Open Meetings Act to the extent necessary to allow governing bodies such as City Council to meet electronically versus meeting physically in one room, you all need to find that it's necessary to protect the health, safety, and welfare of Tennesseans that you meet electronically. So if you all can have a brief discussion and make a vote on that, then that would be great.
All right, and I think we've done it by consensus. Do we need to vote?
I think at this point a consensus is fine since you have voted previously,
Voted,
as long as nobody's
yeah.
changed their mind.
Right, so consensus from council, everybody yay?
Yes.
Yeah.
Right. It's not often that we can do consensus officially or do unison agreement and have it be official. Okay, so today we are really appreciative of our health folks to be with us. That's the main focus. And Mr. Sora, do you want to introduce us to the topic with making arrangements to get people here?
Yes, so I think the issue of the day, certainly with Governor Lee's cessation or stop, or he's not going to renew the stay-at-home order. This does move us into the period of reopening the economy of the state. Sullivan County is one of 5 metro health districts, so they are not required to follow the governor's order. Certainly, they'll give it due consideration. And they're going to speak more to that issue momentarily. And then following that, we have Greg Neal with us, and I think Dr. Couch will be joining. That will talk about Bristol Regional's plan for response and capacity in dealing with the COVID-19 issues. So with that, Mayor.
All right, so I'm looking my squares to see. Gary, are you kicking it off?
I can, Mayor Fire Robin, and I want to thank you and the Bristol, Tennessee Council and all your members for inviting us. And I really appreciate, I'd like to say, working with your city manager, Bill Sora, and your city staff has been wonderful through this crisis and pandemic. And in retrospectively, and I'm without a doubt, we're going to continue that strong relationship as we move forward through the pandemic. And you're correct, the governor announced his intent Monday to lift the stay-at-home order and indicated that some businesses, through his press release, would be open on the 27th of this month. And I understand through Mayor Venable and working with the other mayors in Sulman County that the mayor's staff is working with those metropolitan health departments through the mayors and providing information. I guess the most important question that is on your mind as we move forward is, what is Sulman County's plan to reopen, if you will? And I can tell you that we are working vigorously on our open and criteria. But I can give you some assurance that our plan will be at a minimum of what the governor does. And we don't know what the governor's plan in detail is as of this moment. We hope to learn more today. I think he's having a press conference as we are having this meeting. Well, actually, it may be at 11 o'clock Eastern Standard Time. And so we'll probably learn a little more this afternoon, and we plan on sharing our order with the governor and the Commissioner of Health. We're also working with Valid Health Systems. I've worked with their Incident Commander, Eric Deaton, as we write our order for Sulman County. I fully anticipate that Sulman County's order will closely mirror the governor's, if not a little more explicit for our businesses in our community. But our focus also is to make sure that we have capacity and PPE appropriate to respond in case we get additional cases as the public begins to move and go back to work and so on and so forth. So internally, we are tooling up our folks that do contact tracing and cluster follow-up and epidemiologists. And we're increasing that capacity based on what we've experienced with our case count and the workload that produces, plus the everyday things that we used to do as a health department. We are doubling that capacity. I think that's an important point that you need to understand. The most important element of this as we move forward into phase 1 and phase 2 and phase 3 is that we keep our cases down, trended down logarithmically over a 14-day period. And that's in the White House overall guidance. And that is the playbook that the state of Tennessee will have to use to move through the gates. And there are other criteria, of course, but that is one of the key ones. As you know, ILI, or influenza-like symptoms, is one of the key gates. And I can tell you that in Sulman County, it's already, well, it's practically at baseline, which is normal for this time of year. So we won't see ILI, as we call it, influenza-like symptom graph rise until fall, usually September, October, especially through March. So we'll monitor that. We'll be prepared for the summer and the fall. We just don't know what the disease is going to do or how it's going to react, but we are tooling up again and preparing to deal with that as best as possible. So if I may, Mayor, invite Dr. May to give you an update on the epi curve for Sulman County and give you some latest stat numbers on the cases and so on.
Yes, we're always grateful to hear from Dr. May.
Okay, well, thank you for having me. Just to share you our situational update, looking at both the state and at Sullivan County. The state continues to have rises, or new cases, about 450 to 468 over the last 2 or 3 days per day. And a couple of days before that, it's down about 150. Most of those cases are being identified in Central and West Tennessee. Sullivan County is at present has 47 cases, 1 death, 41 have recovered, 5 that are active, 3 in the hospital. And when we look at the overall death rate for Tennessee, we're operating at about a 2% death rate. We do not have any involvement into our nursing homes. When we look at the national death rate, it's actually significantly higher, around greater than 5%. We are testing through the health department approximately 100 people per day. We have 2 outpatient clinics coming up for testing, one at V.O. Dobbins that's going on today. Slater Center will be on the 30th, where we will provide continued community testing. The nice thing that we're learning is from the testing that we've gotten results back from Monday and Tuesday, we have not had any positives in asymptomatic individuals. That's pretty important, looking at community transmission and control of the disease. So this demonstrates 2 or 3 different things. One, social distancing has worked and has greatly decreased the number of cases and the rate of cases that we were going up from the very beginning. The second thing is we're able to do the contact tracing that is so important in controlling this disease and placing people into quarantine for the 2 weeks prescripted time. So the public health measures are working, and now we've been able to increase our capacity. We've increased our level of PPE. The surge capacity that we've worked with our healthcare systems has been dramatically increased. And as such, compared to 4 weeks ago, we are in a completely different position. Also, when we look at our trend line, we've had a steady decrease in our number of cases over the last 4 weeks period of time, when we peaked about 2 weeks ago. So all this, I think, is good news. It demonstrates the public's goodwill in doing their social distancing. And it demonstrates we've been able to isolate, contact, detect, and quarantine those cases for disease control. Now, moving forward, as we start getting more people interacting, I fully anticipate we will see more cases. But we'll have to look at what is that case rate, what is our ability to respond, what is the hospital's capacity, and what is our ability to do continued contact tracing, investigation, and quarantine. This does not mean that we can go back to the days when we were not using social distancing and not wearing masks. That is still a standard that must be practiced every day. The disease is still here. It has not gone away. It's waiting there for us to make our mistakes as far as not doing this social disease distancing and disease control measures that we currently have in place. We have control today, but we'll just have to watch and see how these numbers change over time as things start opening up and people start interacting once again.
Okay, thank you very much. And council members, do you have questions or comments?
I do. When we're talking about we're going to mirror the state, what are you thinking right now that could be any differences? And are we still planning on, as far as our local businesses, especially restaurants, I believe from the governor's office, could open up on Monday at half capacity, and then on Wednesday, the retail at half capacity? Are we thinking under the same thing that's where we're going to be?
I think at the very least, our minimum public health order from the health department that Dr. May is working on will be what the governor is offering at a minimum. There could be areas because we know our county very well, and we know what our capacities are from working with Ballard, and the capability of our epidemiology teams that are working in the health department. There could be some nuances that may be indicative that we could operate and open up a few more businesses where the governor may not be able to. We both understand, and I'm sure the state government understands, that the federal guidelines, Opening Up America Again, is the title. We are clearly in phase one. So I think mirroring, I may not be using the right word, but I think it is reasonable to say that we, at a minimum, will be where the governor is, but there could be some nuances in our order that would allow more businesses to open.
Right. Okay. I would just, just for the, I think as the public that is watching right now of having an idea of where we're going to be. So great.
And we're handicapped without, I know I would like to give you more specificity, but we're handicapped in the fact that we don't know what the governor's plan is yet.
Right.
And so we're speaking and being a little subjective, and speculation. So, and I look at the federal guidelines, and that is the national scorecard by which we can't really exceed. So,
Right.
Just to add in that the calls with the metro mayors, with the task force, that in the different areas, and that's what it sounded like to anticipate today, that the governor will address those guidelines for industry. And that there are going to be guidelines for restaurants, et cetera, coming from that task force. So I think some of that is what's really helpful to those different industries, is to have a little bit more specific help for what things mean. So hopefully those for industry will roll out today, and that some of the others will follow real quickly from that task force that has included sub-task forces in some of the different areas, such as industry, such as restaurants, such as grocery store, et cetera, to try to look at anything that's particular to that industry and offer some guidance. So hopefully those are going to start rolling out today with specifics, and then those will come pretty quickly. So folks will have a better idea of what's appropriate as they reopen.
Just a couple of questions. In the first phase, when did we actually begin counting those days of a decrease in cases and percentages?
Yeah, it's a good question. I don't know for sure. I will assume that the governor's count will begin when he lifts the order, which could be on the 27th. We don't know. The days that the governor chooses to count that at the beginning of the clock, if you will coincide that with our numbers in Sulman County as well. But our epi curve that I alluded to earlier, which I'm sorry for using technical terms, the logarithmic trend line for new cases in Sulman County meets those requirements going all the way back through mid-March, I will say. And so even if that week moves, that calendar moves slightly, we will at least start off in reasonably good position. Dr. May has said that we'll probably get an increase in cases just by the fact that we're testing more and more every day, and also people moving about more than they were. That's to be expected and reasonable. So what we'll try to do is limit that case increase and keep that logarithmic trend down, so that we'll be eligible to move into phase 2.
And then my second question is in regard to the lifting or renewing of orders. We know that the governor is not going to renew his order, so we can assume that it has been lifted with provisions. Is that correct?
That's my assumption as well.
And so then on a local level, what is the communication to the public as far as orders? Will we assume that the orders will be non-renewed as of Monday, or will there be a new order of specificity?
Sulman County will release an order that will be hopefully closely aligned with the governor. As I mentioned, there could be some nuances where we maybe have a little bit of difference in terms of some business, in terms of opening, not necessarily closing. We have to we have to work within the federal guidelines. And so in order to move through those phases, and Sullivan County will be no different, we have to use certain metrics and key indicators before we can move into phase two. Phase two is a little bit different for population and businesses as we migrate. So that's exactly how we will monitor Sullivan County and move forward. And I believe the state of Tennessee will have to do likewise. It's important to note, and if I may say, where we were in February is drastically different than where we are today. When we were in February and we didn't know, all we had was models, and we didn't know a lot about the disease. We certainly knew we didn't have adequate PPE, we didn't have adequate ventilators, we didn't have adequate surge capacity at the hospitals. And so the lockdown has provided us resources in terms of the federal government, PPE, respirators, and Ballad has drastically improved their surge capacity over time. We are tooling up internally to work caseloads in contact investigations. So the lockdown and the success of our numbers, if you will, has been directly correlated to the lockdown, citizens doing what they're supposed to be doing, regional leaders, our governments in Sullivan County, cities and county working well together. We've had a huge amount of success that's put us in this position that we have today. And so we think with all the resource and capacity built into place that we are ready to execute the governor's plan, and maybe in some ways have a little bit of difference because we do know our county and cities very well. And so it gives us a little more variance, if you will. And I think hopefully we can control this situation and move into phase two expeditiously. Nobody knows.
So would it be fair to say that we are in phase one currently?
We are working as though we are in phase one, as well as the governor. The governor has announced that Tennessee is in phase one, and the president has actually spoken to that. And so we're operating on that premise.
Thank you.
I have a question about testing. This may include Greg from Ballot as well, but Ballard's done an excellent job. Again, their testing standards up to where they get same day results. And I think in some cases, maybe within hours. The testing that we're doing at Sullivan County, I know at one time we were at a 4 to 7 day turnaround time on that. Is Ballard involved in the testing with Sullivan County?
Okay, currently we are sending our drive-through testing results to AEL, and we're getting those results in about 48 hours from the day that we send them out. So AEL has drastically increased their capacity, and we're getting results fairly quickly. Anyone who needs immediate testing, we still have the capability to send through the Tennessee Department of Health laboratory. They're able to provide that result 24 hours after receipt. And of course, if we have an emergency case that we need, we work with Ballad, and they're able to get it processed through their lab, hopefully, usually in a half day or to a day.
So the numbers that we're seeing that's released by Sullivan County are not, they're not in addition, they are in addition to Ballad, or are we seeing numbers from both entities?
You're seeing numbers from both entities. All laboratory results are fed into the Tennessee Department of Health, which is where you see the laboratory number totals, both for positive, negatives, and recovered. All those are fed into the Tennessee Department of Health, and they're posted daily on the website, recognizing that there may be some delay or lag in very small numbers that don't make it in for the cut for that day. That website is TDH. Oh, it just slipped me. Tennessee.gov/health. Tennessee.gov/health. And with that, they're putting the daily updates and numbers, percentages. They also are listing all nursing homes that have greater than 2 cases.
I have one more question. This was asked to me the other day, and so with us in Sullivan County, especially in Bristol, being on the line of Virginia, someone asked if they live in Virginia, but when you go to the Virginia website, looking like the closest testing site that shows is like Christiansburg, I believe, or it's quite a ways away. If someone in Bristol, Virginia is feeling like they need a test, can they come to the Sullivan County Health Department or go to one of these testing sites to be tested or not?
Yes, basically anybody who presents, we will test.
Okay.
And then, of course, that information is sent to the appropriate governmental entity.
Yes, it is. Our epidemiologists do this every day, sending cases, and they send us cases. We've had instances where they have had a positive case tested over there, and they will let us know that it's our case, that we need to do the contact tracing and such for it.
Dr. May, is that correct? I mean, of what I went to the Virginia website, but in Bristol, Virginia, do you have any idea, is there testing sites over there, or is it the closest? I think it was Christiansburg, or it was quite a ways.
Southwest Virginia is way behind on their testing and testing capability. We in Tennessee are much farther along with that. And we do work with our fellow medical directors in Southwest Virginia, both Dr. Cantrell and Dr. Shelton, but they're not near as far along with their testing capability as we are in Tennessee.
Well, I want to clarify too, the reason that they are, a little bit behind Tennessee is not by their own doing. It is by the supplies and the testing capability and direction and so on and so forth. So our colleagues across the state line are awesome to work with, and they're doing everything they can. And we try to strengthen each other and work together as much as possible. So I have no doubt that they will be testing like Tennessee and may even exceed what we're doing, hopefully soon.
Okay, great.
And just of note that the community-wide broader testing is one of the measures to be able to move into the different phases, is having enough of that. So that's they're not there yet with those capabilities. Just a second to go back to the orders. So just for our council, we, meaning Bill and I, and we'll pull Danielle in if we need to. Just looking, we had some discussion for whether we need to renew ours just to be able to have different capabilities. If we do renew ours, it will follow Sullivan County's health order. So and we'll let you know that what's going to happen and why, but just because of what capabilities you have with that state of emergency, et cetera, that it could be a good idea to renew it, but follow the new order. So we don't know yet if that's going to be necessary or not.
Well, and a question to Gary or Dr. Mays, just for clarity, and for those watching, you had said at the minimum we would follow along with the state, that we would have perhaps some other nuances. Are you saying then, in very plain speak, that whatever would come out, it would be more stringent than the states or less stringent than the states?
Well, I certainly don't know, because I haven't seen what the governor is planning to do. I am committing that we will be at least at a minimum with the governor and his proposed guidelines. There could be some nuances that we will be, I guess, less stringent, if that's appropriate. I don't know with that, I'm speculating. But again, going back to balance surge capability, going back to the PPE availability and the resources to deal with cases drives that. in that decision where we may be able to have some nuance that is different, where we can allow businesses to open, whereas the governor has a different perspective. Certainly throughout the state of Tennessee, not all parts of the state enjoy the success that we're having with our lockdown and our citizens working together for their own safety. So, and I mean this sincerely. Our governments in Northeast Tennessee, particularly in my county, Sulman, Bristol, Kingsport, and Bluff City, we've been really working well, and with our health system and Ballard Health System, and tremendous partnership. And so it's been phenomenal, and we cannot forget what's brought us to this success, and this is what's going to carry us forward as we get back to normal.
Just one last comment to all involved. When we first sat down and had our first discussion about this, at the very least, I would say there was great anxiety, and still is to some degree on everyone's part. I know that Gary Mays and Dr. Mays have spent some pretty sleepless nights agonizing over this, trying to be sure that everything was in position. We were really concerned about our capacity for a surge should it happen, and we feel very good about Ballard stepping up and getting everything in place that they have, and looking out for the general welfare of our community. And I just appreciate everything that y'all have done and all of your energies that you've put into it. Thank you.
Thank you.
Okay. And we'll have more comments to wind up, but just in between, before we move to Greg Neal, just saying that I think that public health anxiety is still very much there, with the anticipation that numbers will go up as we open up. Also anticipation that fall flu season will see COVID. So I think as we go forward, we're going to be talking about communication and really trying to be sure that our people stay on board. And I think maybe we can also try to continue to encourage and promote our community and regional pride, and our pride as Appalachians, with how well we are doing, and that we want to be a shining star for our state, and with continuing to do that. And that is very much dependent on our citizens continuing with personal responsibility and continuing to see this as the very large threat that does loom in front of us if we let down our guard or get complacent. So anyway, Dr. May or Gary, do y'all have anything else you want to add before we move to Greg?
I just want to again say thank you, Mayor Robin and the Bristol Council, for your leadership and everything you've done to support our department and working with us. Could not compliment your city manager, Bill Sora, anymore. He's been phenomenal, and all your city staff, and it's been one team effort. There was, you're right, Councilman Powers, there was a lot of anxiety, a lot of worry, and continues to be as we move forward. And I feel strongly that my team here at Sulman County Health Department will respond very well, very dedicated. I have a lot of confidence, and because of the success that we've had. So thank you so much.
All right. And if you want to add in any after with Greg Neals, you can go ahead. So Greg, I think you are ready to go, and you've got a PowerPoint. You're fancy.
Well, good morning, Mayor, and all of you. Thank you for the privilege and the opportunity to share with you some of the work that we've had ongoing here throughout the duration. I've lost track of what day we're on. I think we're into the 50 something now of our, since we've had our command center operations stood up. But Dr. Couch is here with me. I think most of you all know Chad Couch is our Chief Medical Officer here at Bristol and for the Northeast market of Ballard Health. And he's having a little technical difficulties from his own device. So that's why I had the mask on there. We're trying to do the right thing here. And but he'll maybe slide onto the screen here for some of the comments that we want to make. Let me see if I can get my screen shared up here. And can you guys see that?
Yep.
Yes.
Okay, awesome. Well, you know, probably a word I've heard more in the last month than I've heard my whole life is unprecedented, and I think it's becoming a pretty tired word, but it's certainly not hyperbole as it applies to this situation generally and its impact on healthcare specifically. So I want to walk through with you some of the efforts that we've made and are continuing to make relative to our preparedness. I didn't have on the slides here, but I do want to be remiss if I didn't start with reinforcing the comment that Gary just made about the incredible collaborative effort that has been ongoing amongst every stakeholder with respect to the healthcare in our region. Folks from Gary's team and the other health departments, from independent physician practices, the ETSU, Ballad, everybody. We huddle. We have been huddling every day, twice a day, once early in the morning, once later in the evening, just to share sort of what policies and procedures and we're developing as we learn more about this, and we're sharing PPE. We're just flowing information and resources where it needs to be, when it needs to be there at the right time. And it's just been really gratifying to see our region step up and work together the way it has. But internal to Ballad, share with you, obviously, we stood up our Corporate Emergency Operations Center. Eric Deaton is my boss, is serving as the Chief Operating Officer of Ballad, is serving as the incident commander for the system. I'm sure you've seen him in our press conferences as a key spokesman for our efforts here at Bristol Regional. We have our own incident command center as well. It's where I'm speaking to you from this morning. Bobby Murphy, who's our Chief Nursing Officer, is serving as the incident commander for Bristol Regional and has done a tremendous job. We're trying to be very transparent and forthcoming with our communications, the daily briefings we have for team members as well as civic leaders. Hopefully you all are receiving that. If you're not, please let me know that if you're not, but you should be receiving an email every evening, sort of the highlights of the day. The press conferences, of course, we're doing twice a week, every Tuesday and Thursday at 11:30. Those are broadcast on the Ballad Facebook page, as well as I think WCYB is covering most of the content as well. Of course, we have a dedicated website there with all the latest information that is helpful to folks in the community and relative to things they need to be aware of, how to access information and services there at balladhealth.org/COVID-19. Encourage you to check that out if you haven't. And then, of course, trying to be very visible and present with social media alerts as well. We have one of those resources we're pointing folks to is our Nurse Connect line, which has always been in place, but got a dedicated line now for COVID screening. So nurses are available 24/7 for folks that concerned about whether they need to be tested or not. You can call this number on your screen there to speak to an RN. It will help you navigate what you need to do. Of course, screening is an evidence-based practice. We're doing it here in all of our locations, and Bristol Regional, we've narrowed down the number of entrances into the building for team members and visitors and patients alike, so that we can make sure we do an appropriate screening of them, and we get a temperature check, and all of our team members and medical staff members are issued a loop mask like I had on a moment ago. They're expected to wear that when they're on duty. And of course, we're screening patients and visitors as well as they come into the building. PPE preservation is obviously one of the pillars of preparedness for this event. I've just been amazed at the resourcefulness of our supply chain as they, from early on, began aggressively sourcing PPE and have a process in place to systematically, continuously monitor our inventory of all these things. Right on the board right here behind me is the inventory we have for every PPE item you could imagine that we have in the building here at BRMC, and every location has a similar count. The request for donations of handmade masks from the community, which we're providing to the limited visitors that are coming in and patients who didn't bring their own. We really appreciate the community's support. I'll talk more about that later. N95 masks, I heard a lot in the media about concerns about the limited supplies of those. So it was a tremendous benefit when our system adopted the protocols that the FDA has approved to be able to reprocess those N95 masks. We have not had to use any reprocessed masks at this point because we have had an adequate supply, but we are reprocessing them nonetheless, so that we'll just continue to build our stock, and feel very comfortable that that process would serve us well no matter what comes our way. Of course, conservation is been made top of mind for everybody relative to PPE. Of course, everybody have exactly what they need when they need it, but following the science of that PPE and not using it inappropriately when it's not necessary. One of the things that we set up early on was an alternate triage, in fact, an alternate emergency department. I'm sure you've all had an opportunity to be down in the conference center that we're so proud of here at Bristol Regional. You won't be able to do that today because it's been transformed into a what I'd call a satellite emergency department. You see some shots there. Thankfully, we've not had to use this, and hopefully we never will, but it's there in the event that we have an overwhelming or we have a surge that overwhelms our capacity in our main ER. But all the the triage process, the stretchers, all the appropriate distancing and PPE are stocked and ready to go in that event. The testing capacity, which was referred to earlier, relative to what Ballard has been able to stand up, we're really all should be very pleased with that. The benefit to our community puts us way ahead of what a lot of health systems across the country, certainly across the state of Tennessee, have in place to be able to rapidly turn around results for patients that we suspect may have COVID-19 when they come into our facilities, and certainly for our team members as well. Obviously, it's critical that we have the healthcare workforce ready to go in any event. So criteria is in place that we're utilizing to apply the rapid turnaround testing. We have that platform here at Bristol Regional, at Holston Valley, and at Johnson City Medical Center, where we know we have the capability today to test up to 400 patients a day with that rapid turnaround testing, which is within hours of going up, of being collected. The drive-through testing is another measure that we have in place at most all of our hospital locations, if not all of them across the region. Here at Bristol, drive-through testing is, of course, by appointment only. It's done through calling that Nurse Connect line. After they screen you until it's appropriate for you to be tested, you can go there. And it's through our, adjacent to our ambulance bay here behind the emergency department. We started that March 14th, and we've done over 500 tests through that process. Of course, visitation restrictions is an important step as well. You know, it's one of the most, I'd say, difficult things to do to you know, have to put in place a policy for all of our collective protection, but nonetheless difficult to ask loved ones to be separated from their family member when they're in the hospital. But it's a evidence-based practice across the country. We're following that with restrictions in most areas, the exceptions being in labor and delivery, where a significant other can be there with them for the delivery. Same for pediatric patients in our the NICU. And then, of course, in extenuating circumstances on case-by-case basis. If we have, for example, patients that are end of life, we certainly want loved ones to be able to be there with them. So that's, I think, the highlights on preparedness. Just where we sit today, I think you've all seen this map that this is through last night. We've had, and I'm not aware of any that positives that came in overnight, but 303 confirmed positive cases for the Ballard Health Service 21 county service area. It includes the 47 here in Sullivan County. Currently, of those 303, 26 have Ballard Health team members, including team members here at Bristol Regional that are, many have, most of those have recovered, but we still have a couple of our own team members who are hospitalized. And so we'd be grateful for your thoughts and prayers for them. Encouraged by their status, but they've got a long way to go to be fully recovered. Across the system in total, we have 33 patients who are hospitalized now. 17 of those are confirmed cases. 19 more, we're waiting on the test results this morning to confirm whether they are or not. We've had 10 deaths in our hospitals related to COVID-19. And here at BRMC, in our dedicated COVID unit, we have 3 positive cases. And one of those remains on a ventilator. One was able to come off just a couple days ago, who was also a beneficiary of the new plasma treatment that we're part of a clinical trial with Mayo Clinic for. Hard to say, of course, whether that was the difference in that patient's progress or not, but nonetheless, they are improving. Just bed capacity across Ballard Health, we have 2,086 total licensed beds. Of those, 324 we've designated for COVID-19 patients. Those are all able to be set up with negative pressure. We have 245 ventilators in the system. We sit here this morning, 38 of those ventilators are in use. So you can see we have a substantial capacity to accommodate a surge and need for additional ventilation. And we feel very comfortable with the steps we've taken, that we have the sufficient PPE resources in-house. I mentioned that our dedicated COVID unit here at Bristol, we've converted our 3 East step-down unit and med-surg beds into a dedicated 31 bed unit. It's where all of our patients are positive or suspected are being housed, and we have the capacity to go up to open up an entire additional med-surg unit with negative pressure and several ICU rooms as well to get us to 66 COVID bed capacity and 35 ventilators here at Bristol. So obviously it's had the whole situation has an incredible impact on our operations. We, following the governor's order, ceased the non-emergent procedural caseloads in our surgery areas and cath lab and interventional radiology, areas like that. Did that as of March 23rd. Due to the volume reductions, we've also temporarily closed 6 of our urgent care centers across the region, including exit 7 and the one on Volunteer Parkway. So we've consolidated to the one on State Street is continued to operate currently. Of course, the impact on our volume has been astronomical, and it's up to 70% decrease in our volumes for outpatient testing, treatment, inpatient capacity, ED visits. You can see here in the lower acuity visits, which you fairly say, have always been a good portion of those we call avoidable ED visits. Those are appropriately down the highest rates, well over 80% reductions in those. But what's been frankly very concerning is the decline in visits to the ED for more highly acute levels of care, as much as 40% reductions in patients that come to us, and a significant number of those traditionally get admitted to the hospital. So we're very concerned about what's going on with these patients in their homes, and we've heard anecdotally from the coroner that they're seeing increased activity in patients at home that led to their demise. Of course, the financial impact is also been tsunami-like, maybe not too strong of a word. We're projecting about an impact of $155 million in an impact to our cash flow for the system in a 90-day period. That's represents about 80% of what we would anticipate seeing in a year. Of course, that is what it's our lifeblood. It's how we invest in improvements in our facilities and equipment, and pays our debt and other needs in the system. So it's going to be a challenging path forward to navigate our way through that, and we're uncovering every stone we can. I'll talk a little bit more about that in a moment. But also, we've been in very close cooperation and collaboration with the Secretaries of Health in both Tennessee and the Commonwealth, and have agreements for temporary suspension of many of the requirements from the COPA and the cooperative agreement during the extension of the restrictions that being in place and a reasonable recovery period. So some of the countermeasures that we have in place, as patients are appropriately distancing, and aside from emergent care, we're delaying or postponing or rescheduling visits and cases. I'm really proud of the work that our team has done to stand up what we're calling connected care. which you can access virtually anywhere. It's a comprehensive telehealth program using a variety of technologies that allow patients to access their healthcare provider. We have over 500 Ballot Health medical associates, physicians and nurse practitioners and PAs now connected and doing thousands of virtual care visits. We did 1,400 virtual care visits in the first few days of standing this up over a month ago. Probably seeing that many in a day or two now. I can tell you we didn't see 1,400 virtual visits in the last year combined. So we've stood this up and ramped it up very quickly, and pleased with the way folks have embraced that. We also, with the consolidation of the urgent care visits, we simultaneously opened up this virtual urgent care. So for $30, you can access for a significant list of conditions a provider who will get you the care you need 7 days a week. You know, obviously, the financial impact and the volume reduction are has impacted our staffing levels. We you know, obviously don't want to have any more people in the building that need to be here during this time. So that's certainly been a driver, as well as the financial need. So I'm sure you heard about the furloughing of about 1,300 team members across Ballot Health. That's about 9% of our workforce, including 146 here at Bristol Regional that are temporarily furloughed. We've reduced compensation for senior leaders across the system, and as well as the employed members of our medical staff. But proud of the investment that we've made, however, in those folks that are on the front line, that the registered nurses, respiratory therapists, nursing assistants, and LPNs, all specifically, even with lower volumes and needing to be flexed off, those that are dedicated to bedside care, we've guaranteed their paid hours up to their regular FTE status. So they will continue to have that income and be available to us if we have a surge. We've got I'm gonna let Dr. Couts jump in here now, and he's been part of this task force that from across the system that's working on finalizing plans to restart elective non-emergent surgeries. So Chad, do you want to slide in here?
Sure. Thanks, Greg. I don't know if can you see yourself? I can't see yourself. Oh, okay. I can see you. Afternoon or morning. I'll get my, I have a standard issue face mask as well. I went to Georgia undergrad and wanted to wear a UGA logo face mask, but they said I couldn't because of the choking hazard. But we have transitioned over the last few days from our response to COVID to looking ahead of how we get back to some of the things that have been put aside during this period of time. And one of those is elective surgery. So I've been part of a group within Ballot that has looked at this and is developing a plan to reopen elective surgery. One of the things we've realized is that it's a whole lot easier to turn these things off than to restart them. And so we've had a group of stakeholders from across the system that have included physicians, surgeons, anesthesiologists, and other folks that are developing this plan. If everything goes according to plan with the governor's plan to reopen, we are looking towards May 1st with tentative plans to resume elective surgeries at that time. We would be resuming that on a staged basis. looking to initiate at about a 50% capacity of elective surgery initially, with gradually going up to 75 over a couple of weeks period of time, and then hoping to get back to somewhere 90% by week 3 and 4. Again, that's assuming all goes well. Some of the things that will be important in that ramp up period is getting our workforce back. We also want to make sure it's as safe as possible for patients to come in for their procedures. That's really a top priority. One of the things that we're going to initiate is COVID testing for all patients coming in for surgery once we ramp that back up. And so those plans are in development about how that'll actually take place, but that will be one of the key constraints that we'll have to deal with as we open this service line back up. Elective imaging and other testing is also a separate part of that, and that will be also phased in a similar type of ramp up. Anything else you want me to comment on that? Also, just a comment, Greg mentioned this earlier about the convalescent plasma donations. This is part of a research partnership with the Mayo Clinic that Ballard has been able to participate in. This is an experimental treatment. We have had some patients here at Bristol Regional Medical Center that have received this therapy. This is plasma that is taken from patients that have recovered from COVID-19 and then given to patients who are currently in treatment. Again, as Greg mentioned, this has been successful in the patient that received that here. It is always hard to know as part of these experimental treatments if that was because of the treatment itself or if that was part of the natural history for that patient. But hopefully as this information develops, we'll have more knowledge about that. Just a couple of comments. One of our key focuses is to make sure that as a patient comes into the hospital, whether it's during this COVID time or any other time, that we're providing as safe an environment as possible. We just did want to touch on a couple of the quality metric highlights. This data goes back or is reported through February of this year. CAUTI, or catheter-associated urinary tract infections, and C. diff is a hospital acquired infection, many times related to antibiotic use. We've seen some significant decreases in that over our last fiscal year as a result of some very specific programs that we put in place. We also track 16 quality target metrics as part of our COPA scorecard. Happy to report that as of February of this year, we've seen improvement in 14 out of 16 of those quality target measures over our 2018 baseline. And we're also excited that for 6 of those measures, Bristol Regional Medical Center ranks in the top 30% of hospitals nationally. So we're excited about those improvements in quality measures, and we're committed to maintaining that going forward. You want me to touch on this? One of the things that we've seen talked about anecdotally, and there's also beginning to be some evidence presented about that, is as patients are concerned for whatever reason about coming into the hospital, whether that be related to exposure to other patients that might have COVID, or whether that be because they're concerned about coming into the hospital without having being able to have visitors or a family member with them. For whatever reason, we've seen significant decrease in hospital visits and emergency room visits for some significant, even for mild events as well as significant events. And so that's led to a concern that patients are foregoing necessary treatment, which is leading to significant negative events for them. So significant effort now is to try to get the word out that the hospital is a safe place to come to. These COVID patients that are in the hospital are segregated. It is safe for patients to come in and receive the care that they need. And so that's important that we message that as to the best of our abilities to make sure patients know that it is safe. And if they need care, we want them to come get the life-sustaining care that they need. You want me to turn it back over to you?
All right, so we'll try to wrap it up in the interest of time. Don't want to abuse your time any more than we already have. But as Chad said, we really are concerned about welfare of folks that maybe experience things like chest pain or having stroke-like symptoms and are not seeking the care that they need. So we have extraordinary steps in place to protect. Following universal precautions, and definitely need to help folks get into the hospital for the care that they need when they need it. So we'll stop there, and I'll stop here with this comment. We've had just an overwhelming outpouring of support from the community for our team members. Recognizing the sacrifice that they're making with the preparations for dealing with this crisis, and as all of our essential workers have, and first responders. But here's just some examples of some of the love that's been shown us, and just signs and banners and contributions in the form of donated PPE, donated food for our team members, cards and letters, offering childcare for our team members as well. So, and of course, that extends to all of you on the council for your support for our team as well. So I'll stop there. Mayor, I'm happy to take any questions that you might have.
Great. Do we have questions from council? And thank you very much, Greg and Dr. Couch.
Yeah, I have one. Greg, I meant to ask this at our Tuesday night's meeting. Dr. Couch mentioned that when we start doing the elective surgeries here soon, the patients will be required to do the COVID testing. My question is, has the staff been required to have this testing as well already?
Yeah, you want to speak to the process for that?
I'll touch on that. The staff is screened daily as they come into the hospital, and that screening involves questioning and also temperature checks. Certainly any staff that is symptomatic is tested. We're not currently testing asymptomatic staff members. And so certainly once availability for antibody testing, if that was to come available, that could certainly change that thought process. But currently we're not doing routine testing of staff members that are not symptomatic.
And that's following
And that would, yes, and that would be following CDC guidelines.
Others?
I've got not necessarily a question, just comment of thank you guys for everything that you're doing. And I think it's important to stress that with us opening the economy back up in Bristol, that I think we're more than prepared if we do have a surge. And for everyone watching, that you guys have done a great job of preparing us, and everyone should feel comfortable that if we do have a surge, that we've got the ability to take care of it. So thank you, Greg.
Thank you.
Okay. Anybody else? So
Just a follow up to Mr.
Yeah,
Luckel's
yes.
comment. I think Chad actually, Dr. Couch missed out on a call this morning. So we got an update this morning that we do have antibody testing coming to Ballad, and we're looking forward to standing that up here just as soon as we can possibly get those resources delivered to us. So that'll be a great addition to our capacity.
Thanks.
Thank you.
Very comprehensive coverage. We appreciate hearing from you and appreciate everything that Ballot is doing. Also appreciate the hardships to folks personally as well as to the operation as a whole and what that means for our region to have our healthcare system that does take care of us and that we want to be able to continue to count on y'all. So hoping that things are going to look a little rosier in the future. So, or a little less bad, whichever comes first. So anyway, appreciate y'all very, very much. Okay, I think before asking Mr. Sora for an update, Dr. Tudor is on, and I think we wanted to hear a little bit from our school system, who is also out there on the front lines, seeing kids and families every day. Dr. Tudor?
Hello, everyone. I'm sure you're aware that we've closed schools for the rest of the school year. That means our buildings are closed, but we are continuing on with the efforts that we've had all along since we closed our buildings in terms of feeding, providing food, breakfast and lunches for our students, anyone ages 0 to 18 who want to come by and pick up those meals. We still have over 15 sites for that. We've actually expanded and added another kitchen in order to keep up with the capacity and the interest in that program. We also provide additional meals for weekends, so that will certainly continue. Our resources from our Family Resource Center supporting families in terms of providing access to community resources as well as food opportunities for families beyond just feeding their children. Will continue and has continued. As I've reported previously, we continue to and have received a number of donations that have allowed us to provide those services to our families. So those are continuing as well. We are also continuing with instructional opportunities for students in pretty much the same capacity that we've been doing in response to the State Board of Education's rulings last week, or actually 2 weeks ago, I think. We are allowing students to improve their grade as of whatever their final grade average would have been prior to spring break. So that's really kind of the focus for finishing out the school year, is that the work that they've been doing or will do between now and the end of the school year can apply to improving that grade, so they can't receive a grade any lower than what they had before they left for break, essentially, and opportunity to improve that if they so choose. At this point, that will include feeding our families, just like we have previously in previous summers. We'll also, we're hoping to be able to expand our summer school learning opportunities beyond what we typically have offered. So depending on when we're able to open back up and have those programs available, we'll start communicating what that will look like, hopefully even be able to offer transportation to really encourage kids to participate in those for a couple of reasons. One, to help them prepare for the next school year, and also, you know, improve upon grades from this past school year, and quite frankly, to give families a break if they need an opportunity for their children to be somewhere else other than home. So we're hoping that we'll be able to provide those opportunities, and then of course preparing for next school year is our focus all the time. The closer the summer gets, the more we're turning our attention toward what will happen in August when we have students back with us, we hope, in our buildings. So
thank you. Any questions for Dr. Tudor?
Yeah, I do. Dr. Tudor, what's the status of, as far as graduation, prom, of what's being talked about, of how that's going to be handled, and around what time frame we're looking at? Are we looking at June? Are we further out, or the discussions on that?
We actually are still in discussions on that. Nothing has been determined concretely yet. We had a meeting yesterday with all high school administrators to talk about a variety of options. We think we're down the path of a particular option, but right soon after we had that meeting, Commissioner Schwinn was a part of the governor's press conference yesterday. And just prior to the press conference, she pushed out guidance for ceremonies like graduation or award ceremonies, that sort of thing. And so I've just shared that information yesterday afternoon with our high school administrators for them to consider in terms of that. So we are planning something. I don't necessarily want to divulge specifics at this point because we don't know what that will be. But I've also been in communication with the other superintendents in our first core region. There's 16 other school districts in the region that we are communicating with on a weekly basis. And so we're kind of comparing what other school districts are doing and how we're taking care of those situations. And so we are still addressing those. Graduation is our first priority at this point. Prom or something like that will probably happen in the summer or at some point when we can have those kids back together in some capacity. It may not be a traditional prom. It might be a variation of that, but we're still in the process of looking at those options depending on how the next few weeks go in terms of opening back up and allowing folks to be back together in some capacity.
Okay, other questions? So we also very much appreciate our school system, and also I'm imagining that we had a lot of energy for starts, and it's a lot to keep up going at the same level. So really appreciate that settling in to do that. Also appreciate our parents, the ones particularly who are trying to balance a job, accomplishing things at home while they're not even looking at doing the school part, just even having children full-time at home while you're trying to do your work. So everything the school system has done to support those parents and those home situations and those kids who need that support, we just continue to be extraordinarily appreciative of our school system. So
thank you. They've worked very hard, and they're committed to continuing to do that. They love our children very much and want to see what's best for them. So they're doing all that they can to support them.
I think one other thing, congratulations.
oh yeah.
On
being permanent, on being director of school.
Thank you.
Thank you. By the way,
yeah.
that didn't happen since the last time we talked with you. So yes, congratulations, and we look forward to continuing to work with you. Thank you.
I do as well. Thank you.
So, all right. Bill Sora, I was going to call you Dr. Sora. Oh, well.
That's okay.
Dr. City Manager Sora.
And I'd like to thank Dr. Tudor for being with us here today, and also congratulate her. But she'll also be with us Tuesday morning for an update on the middle school and the progress there. I think she also plans to bring Ed Depew, their building construction manager, along with her on that adventure. And also remind Cal, and Annette, we'll have you early on, and our agenda does start at 9 o'clock. We have we'll have a couple of business items to take care of, and then we'll get to your part on the agenda, and then that will be followed with a presentation of our comprehensive plan. So we want to be respectful of your time and be able to allow you to present early and then move on. Speaking of our meeting on Tuesday morning, that we'll open up with a business meeting to consider ordinance 20-6 on second reading. That's very relevant to our overall conversation today. As Mayor Fire-Robin and I were on a conference call earlier this morning with Department of Health officials, as you're aware from their presentation to you today, they're not going to extend the stay-at-home order, but they will come out with a new order that will reflect either the governor's plan or, perhaps in some aspects, less stringent than what the governor is putting out. They have asked us, once this order is finalized, and it's still a working document, as they indicated earlier today, the governor's still rolling out his plan, but they're going to need to do something in terms of an order that will reflect how Sullivan County will move forward with reopening of the local economy. So Mayor Fire-Robin and I will be requested to, on Monday, issue a declaration that references that order And then assuming you all approve ordinance 20-6 on second reading, then the next item on the agenda will be for you all to ratify that declaration. So we'll move through that process early on in our meeting. Then we'll go on it from an agenda standpoint to Dr. Tudor and Ed Dupree for their Ed Depew rather for their presentation, and then we'll move to the comprehensive plan presentation.
And then remind us, then our next meeting is our regular city council meeting the following Tuesday, correct?
As it sits now, if council would like to meet again, it's important for me to know that now for the proper advertising. Generally, it takes us about 48 hours to get an advertisement into the paper, and then that needs to be in 24 hours in advance of the meeting. So if you, for instance, if you want to have a meeting next Friday, you could make that decision on Tuesday, but we would need to be moving forward with that advertisement so it can get in the paper by Thursday to have the meeting on Friday. So if you don't want to have another meeting next week, that's okay. We just need to know from an advertising standpoint and compliance with our open meeting statutes.
So if we wanted to have a meeting on Thursday, it really would be helpful to make that decision today.
That's correct.
I think it would be best to advertise the meeting. If it comes to the point that we don't need the meeting, we can always cancel the meeting and not be in a scramble to schedule a meeting.
Just tell me which day you would like to do. Today we can do Thursday if you'd like. If we wait, or even you could let me know Monday, but and we could do Thursday. But if we make that decision on Tuesday, we'd need to go all the way to Friday. So just give me a date, and we'll be glad to advertise it and move forward.
I don't have a preference, just at the will of council. What do y'all want to do, Thursday or Friday?
I have a standing 11 o'clock coordinating services meeting that I am missing right now. So on Fridays, I would prefer Thursday to Friday if we're going to have 2-hour meetings. So
I'd prefer Thursday as well.
Okay.
Okay, so if that's the will of council, then we'll advertise for a called meeting on Thursday. That would be the 30th, April the 30th at 9 a.m. I think is what we've typically done. Today was a little different, but typically we've gone at 9 a.m. If that's the consensus of council.
Yeah, and we're still on for 9 a.m. on the 28th.
That is correct. That is correct.
Okay. All right. Thank you very much. Council, do you have updates or comments or things you want to share?
Well, I think it's very impressive what has happened through our health department with our state. I think once again, Tennesseans and those Tennesseans of Northeast Tennessee have stepped up and have made an outstanding effort to protect our community. I think moving forward, it's very important that because it's like they've said all along, the switch isn't going to be flipped and everybody's not going to go right back as it was once before. I think it's important that people have as much information as they can, because there are a lot of people that have businesses where they have to schedule appointments, where they're going to have to put in these health and safety measures. And the sooner we can get that information, the better. My question is, I assume that there will be a plan announced and made known to us by Monday at the latest.
So Sullivan County will have to come out with what they have. From what I'm seeing with the governor's task force, the stuff will be coming out next week. Whether all the details are available on Monday or not, I'm not sure whether that is true or not. I think the governor, when he announced, he talked about some businesses may be able to open on the 27th, but there was lack of clarity for that. So everybody's struggling a little bit with how that announcement came down, and the good work that the task force is doing with offering, and the task force is working with the health advice to finalize some of those. So Sullivan County absolutely will have some directives as to how detailed, or whether some of it depends, the details on the governor's task force finishing up. And I imagine those will come out next week, during the week. If not completely by Monday, that his order expires Thursday night. So I would think all the guidelines would be available by that time.
Well, and of course, we'll have more information after the press conference later this afternoon. I'm sure there'll be a written follow-up to that as well. But, I think we're moving in the right direction, trying to get everything opened back up. As I said, a lot of people are struggling. And to Dr. Tudor, I think it's a wonderful thought to try to get our students. I know y'all worked very hard to get eyes on the students to be sure everybody's in good shape, and the meals have been great, but it'll be good for them to have some consistency back into their life as well. So thank you for all y'all have done.
I think Councilwoman Powers, to answer your question, and I know all of you are having constituents ask you about
Right.
the reopening plan. I think, and right now for Sulman County, that's a little bit different because we're a metro. But I think absent a plan right now that is detailed from Sullivan County, probably the best counsel that you can give is to refer them to the governor's plan. And I think you heard earlier today that if there's a deviation from that plan, it will actually be less stringent, not more stringent. So
Right.
I think you could refer them. I feel like the governor's plan will be on the various platforms that they have pretty soon. The governor actually began to roll that out, I think about 30 minutes ago in a press conference. So there's probably information that's being released now. I know that Mayor Fire-Robin and I will be on a call in about an hour with their team that's working with the 6 or the other 5 or 6 metro health departments. So I think we'll know a little bit more about that. But that's probably the best thing to do, is refer them to the various websites that the governor uses. And if anything, we'll be less stringent.
And we'll appreciate y'all been, Bill, you've been especially helpful with your follow-ups in the afternoon as to the statistical data coming from Sullivan County, and Margaret with your updates as to the conference calls you've been on. And we'll look forward to hearing from both of those. Thank you.
Yeah, and I would just say, when we started out in this, a week was an eon. Things change in just a couple of days. So I think we're back into that, maybe not quite in the same feeling of crisis, but there is a lot of pieces moving. There's a lot going on. There's a lot we're still waiting to find out. And some of the processes, I think I've talked that how when we go through processes as a council, sometimes it takes a lot longer than what we anticipated, with wanting to get the right information, with wanting to hear everybody's opinion, with trying to be sure we get it right. So add that, multiply that several times at a state level, and things just take time to do a good job. So just having patience that some of those meetings have to occur, some of those people have to weigh in, and some of that takes longer than what we like, but that's what's needed to come up with the best result. So appreciate all of us understanding and having patience as things move forward. And the time frame is very short anyway. I mean, we're talking, if you don't know today, you're going to know either tomorrow or the next day or whatever on a lot of things. But things just take time to fall into place, come into place. Anybody else?
I'll just mention real quick also too. Great advice to look at what the governor is saying, try to follow along those guidelines. But I think the public should also take in mind that reopening is a little bit more difficult for some than others. And so check websites of businesses, restaurants, and see how they're coming along. I would also encourage our businesses to use their signage for instructions about how they're opening up. And I think patience over the next week or so, and I think will be important.
Yeah, also, I think some of our restaurants are in contracts to provide food in various ways. So some of those may continue doing that for a period of time or continue with carry out. It also depends on how quickly they can get staff back for doing different things. Some of those employees may have compromised health situations at home. So yes, it will take time to do that. And what's important is taking care of everybody, taking care of employees, taking care of the public, our citizens as they go back. So I think that's absolutely correct. Vince, did you have anything to add?
No, I think all been said, but it's good news, I think.
Hey, but Malin, anything?
Yeah, I'd just like to add and comment that, we're very fortunate as a community to have the dedication and professionalism of our health departments, hospital, educational staffs, and especially our entire city staff and leadership team. I feel like our future is very bright, but we still have to move very cautiously. And be sure and you reach out and check on your neighbors and make sure that they're okay. But yeah, feel good.
So also to add a note that I made is also supporting that PPE that the personal protective equipment, which for homes that can be personal mask. I know I have not sourced wipes yet. I have sanitizer that I can substitute, but don't have wipes. So I know the state was checking with supply chains that would be going to restaurants to check on that status. But some of our folks may have difficulty resourcing those things. So that's really important as those that come back online. Also, all the orders for phase 1 and I think up to phase 3 is if you're a part of a vulnerable population, you want to continue staying home, continue with the routine that you already have, continue limiting shopping, grocery shopping, etc. And hopefully a lot of our workplaces will phase things in that if people can still work at home, that can happen to limit. I think it's critical for us, and we talked just briefly as a region, and hopefully it's already starting with our communications departments to, as a region, start those messages that those CDC guidelines are more critical now as we open up than they were several weeks ago. There's going to be more opportunities for spreading disease as we open back up. So we want our citizens to continue doing the due diligence with following those sanitary, washing hands, cleaning your spaces often, and the social distancing for sure. And it's still, phase 1 is still 6 feet apart, and some of the research shows it's even possibly more than that. So trying to really emphasize that, send that message out in different ways, that's critical as we go forward. And our success, again, I would love for our community and our region to continue to enjoy the success that we've had. And one of the reasons for flattening the curve, and we feel like we have had time to prepare ourselves and prepare our health department and our hospitals. The public health people do anticipate numbers going up. They do anticipate the flu season with numbers up. So we cannot let down our guard, and we need to keep things going. Personally, I know we want to protect our healthcare delivery system, but personally, I don't want anyone in our community to experience the ravages of this disease. Just reading what happens with some folks and how serious it is, I just hope pray and want everybody to take the actions that we protect each and every one of us, and that no one has to end up in our hospitals on a ventilator struggling. So that is my hope. That's my goal. That's my prayer, that's where we can go. So I guess we will see everybody again on Tuesday morning. And like I said, between now and Tuesday, the whole Tennessee world can be different than it is right now. So look forward to seeing everybody then. Good?
Goodbye.
Bye.
Thank you.
Dean signing off.